Question 26. The nurse takes the medical history of a 67-year-old male with a diagnosis of benign prostatic hypertrophy, BPH. As he describes his BPH symptoms, which one is most serious? A. Acute urinary retention. Benign prostatic hypertrophy, BPH, is a common condition in males. About 1/3 of men experience moderate to severe symptoms by age 60, and about half do so by age 80. Acute urinary retention, AUR, is the inability to voluntarily pass urine. It is the most common urologic emergency. Initial management includes bladder catheterization for prompt and complete decompression. Alpha blockers are often prescribed. Question 27. In order for the nurse to accurately assess the progress of a client in a weight loss program, which is most effective? B. Weigh the client consistently. Measuring the client's weight is the most accurate and reliable method of determining weight loss. Weight should be taken in a consistent manner, same scale and same time of day, with the client wearing the same clothing. The other options are methods of determining nutritional and hydration status. Question 28. A 43-year-old client makes an appointment at the OB clinic because she thinks she might be pregnant with her first child. An examination confirms the pregnancy. The client tells the nurse that her last period began on July 12. Using Naegele's rule, the nurse tells her that her estimated date of delivery, EDD, is C. April 19th. According to Naegele's rule, the estimated date of delivery, EDD, is calculated by adding 7 days to the first day of the normal menstrual period, July 12 plus 7 days equals July 19th, and then counting back 3 months. July 19th to 3rd months equals April 19th, the other dates are incorrect. Note, EDD replaces the former term, estimated date of confinement, EDC. Question 29. Cirrhosis of the liver can promote prolonged bleeding. Which of the following should the nurse anticipate administering to counteract this complication? C. Vitamin K. Vitamin K is a fat-soluble vitamin that is essential for clotting. The other vitamins do not directly affect the clotting process. Question 30. For a client scheduled for an angiogram, which of the following nursing considerations is correct? B. If the client has an iodine allergy, they should be administered an antihistamine. An angiogram is used to evaluate specific areas of the arterial system by injecting a dye through a catheter at the femoral or radial artery. The dye will make the coronary arteries visible on fluoroscopy. Nursing considerations include the following. 1. Informed consent must be obtained. 2. Clients must be evaluated for a history of allergy to iodine or radiopaque dye. 3. If an allergy to iodine or dye exists, the client may be pre-medicated with an antihistamine. 4. Clients with impaired renal function are at an increased risk of further renal damage and may receive a large amount of fluids to flush out the contrast dye used during the procedure. Generally, clients are NPO 3 to 8 hours before the angiogram. Elderly clients have diminished organ function, making it harder to clear sedation and contrast dye from their systems. Question 31. 2 days after major abdominal surgery, the client remains NPO, with 4 fluids at 150 milliliters per hour. The client tells the nurse that she is hungry. The nurse tells the client that oral intake can begin when? C. Bowel sounds are present. Bowel sounds indicate the return of peristalsis. After major abdominal surgery, bowel sounds usually return within 72 hours. At that time, the client can begin with clear liquids, advancing to a regular diet as tolerated. If no bowel sounds are detected, the client remains NPO and the surgeon is notified. Vital signs usually stabilize within 24 hours. The incision is not related to intake. Question 32. When providing nutrition education for a newly diagnosed diabetic client, the nurse uses guidelines from the American Diabetes Association. What are their recommended proportions of nutrients? C. 50% non-starchy vegetables, 25% protein, 25% carbohydrates. The ADA diabetic plate method includes 50% non-starchy vegetables, 25% protein, 25% carbohydrates, provides balanced nutrition to maintain blood glucose levels, enough protein to maintain body repair, and enough fat to ensure palatability. Non-starchy vegetables are low in carbohydrates and high in fiber. Examples can include broccoli, Brussels sprouts, cauliflower, carrots, cucumber, and leafy greens. Lean protein includes fish, chicken, lean beef, soy products, eggs, and cheese. Carbohydrate foods include starchy vegetables, beans, legumes, fruit, yogurt, and milk. Clients should be advised to use a 9-inch plate for their meals. Question 33. In a normal sinus rhythm, what does the P wave of the electrocardiogram, ECG, indicate? B. Atrial depolarization. The P wave is the first electrical impulse in the cardiac cycle. And NBSB. It shows the atria depolarizing and contracting. And NBSB. The first electrical impulse for the heart is generated at the sinoatrial SA node, which then depolarizes the atrial cells and causes them to contract. This pushes the blood from the atria into the ventricles. The normal duration is less than 0.12 seconds. Question 34. EMS transports a client who fell from the roof. On arrival at the emergency department, the nurse performs an assessment. Which finding is most indicative of a serious head injury? B. The client has serous fluid draining from the ears. The most crucial finding is the clear, serous, fluid draining from the client's ears, indicating a tear in the meninges and a risk of infection. The fluid is cerebrospinal fluid. The other findings should be attended to, but they are not the priority. Question 35. The spouse of a client with type 1 diabetes brings the client to the emergency department because the client is exhibiting signs of diabetic ketoacidosis, DKA. Diagnosis of DKA is confirmed and the client is admitted for treatment. The nurse asks the spouse about any factors which may have contributed to the DKA episode. Which of the following is most likely to have triggered the client's DKA? C. Current urinary tract infection. The most common cause for diabetic ketoacidosis, DKA, is underlying or concomitant infection, 40%. Infection causes a release of cortisol and adrenaline, which work against insulin. The result is high blood glucose levels, causing DKA. Other causes include missed insulin treatments, 25%, new undiagnosed type 1 diabetes, 15%, and other situations, 20%, such as poor compliance, failure of insulin pump or catheter obstruction, medical surgical emotional stress, or brittle diabetes. Exercising causes blood glucose levels to drop. Mild stress does not impact glucose levels enough to trigger DKA. There is not a correlation between diabetes and happiness. Question 36. Following the birth of an infant at 42 weeks gestation, what can the nurse expect to observe when assessing the neonate? B. Loose, peeling skin. A post-mature, or post-term, infant has dry, loose, and peeling skin. Other signs of post-maturity are overgrown nails, a full head of hair, visible creases on the palms and soles of the feet, minimal fat deposits or a thin appearance, and a more alert expression. There may also be a green, brown, or yellow tinge to the skin from meconium staining. The other options are characteristic of preterm infants, born between 24 and 37 weeks gestation. Question 37. A client with a diagnosis of possible appendicitis is a direct admit from the clinic. The nurse knows that a positive sign of appendicitis is A. Psoas. A positive psoas sign indicates the presence of inflammation of the psoas muscle. A positive Murphy's sign indicates cholecystitis. A positive Hohmann sign is related to a deep vein thrombosis in a leg. A positive Chadwick sign is normal during pregnancy. Question 38. A client presents to the emergency department, complaining of chest pains and is placed on a cardiac monitor. Shortly thereafter, the nurse sees this heart rhythm on the monitor screen. What is the first thing the nurse should do? C. Initiate cardiopulmonary resuscitation. The monitor shows ventricular fibrillation, VFib. This rhythm is life-threatening and requires immediate CPR and defibrillation. Calling for the code team and administering O2 are important, but first CPR must be initiated. Continuing to monitor the rhythm is not appropriate. Question 39. EMS transports a client severely injured in a motor vehicle crash. The emergency department nurse does a rapid assessment and notes that the client's vital signs are BP 11650 mmHg, pulse rate 112 bpm, and respiratory rate of 28 breaths per minute. Which action should the nurse complete first? C. Administer oxygen as ordered. Shock involves ineffective tissue perfusion and acute circulatory failure. Early findings of shock are associated with hypoxia and manifest as hypertension, tachycardia, and tachypnea. The nurse should use the airway breathing circulation (ABC) approach to prioritize interventions. Maintaining adequate oxygenation is critical, and oxygen should be administered and NBSB first. The other interventions are secondary to oxygen therapy. Question 40. Which of the following findings indicates the need to immediately stop a treadmill, exercise, stress test? B. Chest pain of 4 on a 0 to 10 scale. A report of chest pain can indicate myocardial ischemia. The test should be stopped immediately to avoid injury or infarction. An exercise stress test is usually performed on a treadmill. It requires about 8 to 12 minutes of making the heart work harder than baseline. The test is stopped for client complaints of chest pain or dizziness, severe or unexplained shortness of breath, extreme hypertension or hypertension, arrhythmias, or abnormal changes in the ECG. Changes in vital signs related to exercise, such as increases in blood pressure and pulse and a decrease in oxygenation, are considered normal and should continue to be monitored. Question 41. A client presents to the emergency department with an oxygen saturation, SAR2, of 78%. The client is able to breathe without assist. What oxygen delivery system will best increase the client's SAR2? B. Rebreather mask. A normal O2 saturation is an GT, 94%. When SAR2 is below normal, the O2 delivery system depends on the SAR2 level. A nasal cannula is a low-flow device used for mild hypoxia. It can be set between 1 to 6 liters per minute, LPM, delivering 24 to 40% FiO2. FiO2 is the fraction of inspired oxygen, the concentration of oxygen in the gas mixture. The gas mixture at room air has a fraction of inspired oxygen of 21%. A simple face mask is also a low-flow device, set between 5 to 10 LPM, delivering 35 to 55% FiO2. A non-rebreather mask is a low-flow device that uses a reservoir bag to deliver a higher concentration of O2. The one-way valve prevents inhalation of expired air. It is set between 10 to 15 LPM, 80 to 95% FiO2, and used for severely hypoxic clients who are able to ventilate well. A Venturi mask is a high-flow device that delivers a precise measurement of O2. It has different sized ports to change the amount of FiO2 from 24 to 50%. Question 42. The nurse is caring for a patient who was admitted with a diagnosis of deep vein thrombosis. The provider orders heparin infusion therapy. After 24 hours, the nurse reviews the patient's partial thromboplastin time, PTT, and notes a result of 70 seconds with a control of 30 seconds. Which is the nurse's most appropriate action? A. Document the PTT in the patient's medical record. The range for therapeutic anticoagulation is 1.5 to 2.5 times the control. For this patient, the range is 45 to 75 seconds, so no action by the nurse is necessary. Question 43. Which finding accurately describes grade 3 pitting edema? A. Pressure leaves an indentation of 5 to 6 mm that takes up to 30 seconds to rebound. Pitting edema is an indentation that remains after pressure is removed. Grade 1. Pressure leaves an indentation of 0 to 2 millimeter that rebounds immediately. This is the least severe type of pitting edema. Grade 2. The pressure leaves an indentation of 3 to 4 millimeters that rebounds in less than 15 seconds. Grade 3. The pressure leaves an indentation of 5 to 6 millimeters that takes up to 30 seconds to rebound. Grade 4. The pressure leaves an indentation of 8 millimeters or deeper. It takes more than 20 seconds to rebound. Question 44. An arterial line may be used for all the following purposes except B. Measuring cardiac output. An arterial line, ART line, is a small catheter, similar to an intravenous, that is inserted into an artery. They are commonly used in critical care for several purposes: arterial blood tests, such as blood gases, ABG, easy blood draws for laboratory tests, closed blood pressure monitoring. And NBSB. Cardiac output can be measured with a pulmonary artery catheter, such as a Swan-Ganz catheter. Question 45. The nurse in a medical unit is admitting a 79-year-old male with a known history of benign prostatic hyperplasia, BPH. Which assessment finding requires immediate intervention? C. Ultrasound of bladder with 850 milliliters. Acute urinary retention in men is most commonly secondary to benign prostatic hyperplasia, BPH. Urine accumulates in the bladder and is obstructed by an enlarged prostate gland. BPH is the most common prostate problem in men, which will affect almost all men as they age. By age 60, 50% of men will have some signs of BPH. By age 85, 90% of men will have signs of the condition. The elevated heart rate and blood pressure and the severe abdominal pain are signs and symptoms of acute urinary retention. They will most likely resolve when the retention is resolved. The high bladder scan ultrasound value confirms the retention of a large volume of urine that will require catheterization. Question 46. Cystic fibrosis is an autosomal recessive disorder. How is it transmitted from the parents to a child? B. Both parents must have the gene. To have an NBSB, autosomal recessive disorder, you inherit two mutated genes, one from each parent. These NBSB disorders and NBSB are usually passed on from two carriers. Their health is rarely affected, but they have one mutated gene, recessive and NBSB gene, and one normal gene, dominant gene, for the condition. Question 47. In a normal sinus rhythm, what does the QRS complex of the electrocardiogram, ECG, indicate? A. Ventricular depolarization. In a normal ECG, the QRS complex represents ventricular depolarization and atrial repolarization. The ventricles are contracting and the atria are resting. The normal duration, interval, of the QRS complex is between 0.08 and 0.10 seconds. A QRS duration of between 0.10 and 0.12 seconds is considered intermediate or slightly prolonged. A QRS duration of greater than 0.12 seconds is considered abnormal. Question 48. A client with a diagnosis of cancer of the larynx is transported to the ICU after an uncomplicated total laryngectomy. As the nurse provides care for the client, which of the following is an early sign that the client's oxygenation is inadequate? D. The client is restless. Early signs of hypoxia are anxiety, confusion, and restlessness. If hypoxia is not corrected, hypertension will develop. Respirations become rapid and shallow. Tachycardia may develop, not arrhythmias. As hypoxia worsens, the client's activity tolerance and level of consciousness will decrease. A total laryngectomy is the removal of the entire larynx. The trachea is then brought up through the skin of the front of the neck as a stoma that the client breathes through, tracheostomy. Question 49. A pregnant client experiences a spontaneous rupture of membranes at 36 weeks gestation. She is admitted to labor and delivery. What is the nurse's first action? D. Measure the fetal heart rate. Following the rupture of membranes, the fetus is at greater risk of complications than the mother is, so the nurse should start by assessing the fetal heart rate. After assessing the mother and stage of labor, the nurse can notify the provider. There is no evidence of a precipitate delivery. Question 50. For a client scheduled for an angiogram, which of the following nursing considerations is correct? D. If the client has an iodine allergy, they should be administered an antihistamine. An angiogram is used to evaluate specific areas of the arterial system by injecting a dye through a catheter at the femoral or radial artery. The dye will make the coronary arteries visible on fluoroscopy. Nursing considerations include the following. 1. Informed consent must be obtained. 2. Clients must be evaluated for a history of allergy to iodine or radiopaque dye. 3. If an allergy to iodine or dye exists, the client may be pre-medicated with an antihistamine. 4. Clients with impaired renal function are at an increased risk of further renal damage and may receive a large amount of fluids to flush out the contrast dye used during the procedure. Generally, clients are NPO 3 to 8 hours before the angiogram. Elderly clients have diminished organ function, making it harder to clear sedation and contrast dye from their systems. Question 51. A client is admitted with a diagnosis of central diabetes insipidus, related to insufficient secretion of antidiuretic hormone, AD. Which urine-specific gravity result supports the diagnosis? D. 1.002. A urinary specific gravity of 1.005 or less and a urinary osmolality of less than 200 mol/kg are indicators of diabetes insipidus. Diabetes insipidus is caused by a lack of antidiuretic hormone, ADH, also called vasopressin, which prevents dehydration, or the kidney's inability to respond to ADH. ADH enables the kidneys to retain water in the body. When diabetes insipidus is caused by a lack of ADH, it is called central diabetes insipidus. This form of the disease can be caused by damage to the hypothalamus or pituitary gland. The normal range for urine-specific gravity is 1.005 to 1.030.